We are trained exclusively in taking care of the anesthetic needs of children. We are also able to provide a whole family experience because kids are just different. They're not little people. When you're dealing with an infant, the first years of life, there is a very rapid growth and change. Okay? So you and I may gain a couple of pounds here and there, and our brains may subtly change over time, but it's nothing in comparison to what a child is undergoing in terms of growth and development. And it's not just weight, it's their breathing control in their brain, it's how they respond to different medicines, it's their heart rates, it's everything. And so you capture these children in a very rapid phase of their growth and development, and you have to custom tailor your anesthetic to those differences. What we look at as anesthesiologists is not just keeping you asleep. We look at how you do afterwards. So what do we care about? We care about pain control afterwards and minimizing the side effects of how we take care of kids. So a major difference with when you deal with side effects with children is a lot of times they can't tell you what's happening. And that's a major challenge. And we've been able to, over time, really tease out what bothers children. And we have objective scales of saying, is a child in discomfort? And we have a unique ability with our staff to have amazing post-anesthesia nursing. The post-anesthesia nursing has more experience with post-operative pediatric patients than anyone in any other institution will have, except for other children's hospitals. And I think one unique thing is that we know that children don't like being in pain. None of us do. We know that children don't like being nauseated. None of us do. But it's not just that. It's when you take a baby that is 3 months old and realize that they need to be swaddled. They need to have a pacifier in their mouth. And so it's the small things that our staff can provide that's very different than being scared of this little baby that's just post-recovery in front of you. And I think that you see that our nurses in our post-operative area will have the perfect swaddle. They will have the perfect, we call it baby burrito. They will have the milk in the kid's mouth before they're half awake, and the kids are comfortable. And I think that attention to the needs of the child, not the patient, the child, comes first at our institution. We had an extremely scary case about 2 weeks ago where we had to keep a child calm for a couple of minutes. And instead of providing a powerful sedative that could have had some side effects, we went directly to the songs from Moana. And I'm not a very good singer, but I know my songs from Moana, and I have my children to thank for that. And so I was able to keep the child calm for about 10 minutes by singing a couple numbers from Moana. Well, you're meeting a parent and a child on a really lousy day for them. No one wants to be in the hospital. And so the energy that I think needs to be provided is a very positive energy that comes and says, I'm going to be your protector for now. And I'm going to be your defender for now.